Music therapy as an intervention for pain and anxiety by
Nicole Kilpatrick,
April Dorney,
Julie Curatio, Tanya Barron.
and Morgan Young.
Pain and anxiety is a widespread and expensive problem. The exact cost is hard to determine because pain is a personal and subjective experience. One estimate on the cost of pain to businesses due to loss of productivity is $61.2 billion per year. Chronic pain is a highly prevalent issue and not always treated well with analgesics. Anxiety is defined as a reaction to a threat of a serious disease or of a possible injury. Patients suffering with anxiety may have their treatment and their recovery hindered by their psychological status. Music has been a part of culture throughout history and has been linked to health and emotional well-being since the times of Greek mythology. Tanya is now going to tell us about our review of literature.
As a group, we all used Ovid Sage or CINAHL to do a search or use those databases. Our initial search brought up about 2,500 results when we used alternate therapy, music therapy, or pain. We further narrowed that search in order to answer our PICO question, which was, does the introduction of music therapy decrease or change a patient's pain and anxiety level, by limiting those searches to full text articles, using pain, anxiety, depression in the adult population. Based on that narrowed search, we narrowed it down to 5 articles which were reviewed by the group. And overall, in those articles, it was shown that pain and anxiety are decreased with the proper use of music therapy. And in the control groups for all the research showed that pain and anxiety in some of those groups actually increased for the groups that did not receive the music therapy. An overarching theme, though, for all of the groups was that there has to be more research done on this topic for bigger populations, because initially all of these groups were small groups. Needs bigger populations and also needs extended the research for a longer period of time. These were short periods of time. If music therapy is to be used appropriately, it should be used music with 68 beats per minute, music that is non-percussive with no language, with no speaking in it, with some of the parameters that was given for the music therapy to work. And based on our summaries of findings, we put together a recommendation for practice, which Nicole was going to talk about.
Since there has been an increase in alternative therapies, including music, it should be used in a variety of settings, or it can be used in a variety of settings. Alternative therapies at this time are not considered an integral part of medical practice. At this time, 94% of disease-related symptoms were not relieved by conventional treatment. Music therapy should be provided by a trained professional, and that trained professional is a music therapist. If the music therapist is not available, the nurse should be the individual to educate the patient on the positive effects of music therapy. Patients should be allowed to choose their preferred music to listen to and be able to listen to it at their discretion. So at this point, we will move on to the implementation.
The implementation can be carried out by a music therapist, or when they're not available, a nurse, which either can evaluate the patient for their goals and their focuses for what they want to get out of the therapy, and they want to ensure that a variety of music can be available to the patient, especially what the patient prefers. The patient should be in a relaxing, comforting area where they can focus, and it should be taught to the patient that they can use this therapy anytime that they are in pain or when they deem it relevant. Now on to the conclusion.
As previously stated by April, pain and anxiety are widespread and costly. Music therapy is non-invasive and low-cost and convenient alternative therapy to reduce anxiety and pain in patients. Patients in each of the studies we reviewed had a decrease in pain and anxiety. Music therapy can be used in a variety of settings for a variety of ailments, including cancers, after painful surgeries or procedures, or chronic pain.